Excellent. So welcome everyone. Thanks for joining us in our Maine State Breastfeeding Coalition meeting. I mentioned earlier, if you could make sure that your name is clearly spelled. If you aren't familiar with the format, you go to the participants and you find your name and you click on the arrow that will give you the option to, on the more button, it'll give you the option to rename yourself. So that is great when we keep attendance. We will know who is who. And you're welcome to, in the chat box, introduce yourself and where you are coming from. If you are with an organization, you're also welcome to include your pronouns there as well. And my name is Kara Kaikini. I'm a lactation consultant. My pronouns are she and her, and I'm the board president of the Maine State Breastfeeding Coalition. And I'm really happy to see you all here today. Looking forward to connecting in the second half of our meeting and in the first part of the meeting, hearing from Ashley Olen. So as you can see on our screen, I hope we have the first few minutes of getting grounded, making sure everyone's feeling comfortable with the chat box, knowing where your camera button and your mute button are. That's always good to know. You're welcome to keep your cameras on. I think it's really nice to be able to see you during this meeting, so we feel like we're all here together. So thank you if you're able to do that. And our agenda for today is I will spend a few minutes after this first part here to give an update on what we're doing here at the Maine State Breastfeeding Coalition with the board anyway. And then we will hear from Ashley about the plan of safe care, part of the maternal opioid model here in Maine. And she has a PowerPoint that we'll share. And then we will spend about an hour doing our connecting the dots portion of the meeting. And that's where we're all sharing any new knowledge. And Amanda Powell will be facilitating that. You'll have the opportunity to do a full introduction. She'll essentially go down the participant list and call in each person. So be prepared to introduce yourself and share anything that you think would be really great for other people here on the call to know about what's happening in your part of the state. If you have any legislative updates, I know I have something to share and Brooke has something to share. If there's anything new, any new research or new articles you've heard about that you would like to share. And if you're having any challenges in your current workplace, that's a really great time to see if anyone else is experiencing that and what advice people might have to offer you if you're looking for that. And it's also a great time to make any sort of announcements if there's anything that you know about or that you would like to share. So that is the plan for today. If you have any questions, feel free to unmute yourself or I'm going to stop sharing my screen here or type in the chat box at any time. Okay. So in terms of new board updates, we did apply to become members of the United States Breastfeeding Committee, and I hope that that is something we hear back from soon. It was more than just a quick, yes, we would like to become members of the USBC. It was a more thorough application, which was a really good practice for us. And we are keeping our fingers crossed that we will be able to be members. And that gives us the opportunity to vote and participate a little bit more with the United States Breastfeeding Committee, have a discount on the conference that they have every year. That'll be happening next week, actually. I don't know if anyone here, I know Petrichor will be attending. I don't know if anyone else here will be attending that meeting. It is virtual this year. And in years past, you've heard me say before about how wonderful that is. So we hope to hear more about that. Otherwise, we continue to work hard on our strategic plan. We mentioned at the last meeting that we shared the strategic plan at our last meeting and we were looking for feedback, and we're going to be sending out a survey. I think I can grab that link and put it in the chat box actually, for you to give some feedback and just let us know, do you feel like this is well aligned with the Breastfeeding Coalition's mission? Do you feel like it will be helpful at helping the state meet the exclusive breast milk feeding goals and breast milk feeding at 6 months? Do you feel like we're missing anything? And which part of it are you most excited about? Which part do you think should be priority? And what would you maybe like to help with? So I will grab that link and drop that into the chat box. First, you can take a glance at this PDF. I'm putting that in the chat box there. That is a PDF. You might have to do some zooming to be able to see everything a little more clearly, but that's what we have available for you right now to look at, and that's shareable. And then once you've looked at it, this is where you can grab this link here. This is where you can give your feedback in that by clicking on that link. So please do that, and please share that with your friends and colleagues and anyone who you think might have some feedback. If we can have feedback from actual breastfeeding or chest feeding families, that would be excellent as well. So feel free to share with anyone that you're working with too. I will be sending an email out through the listserv as well, so we can reach people that way and also through social media. Right. Does anyone have any questions? Okay. Okay, I'm just sorry, looking back at the chat box, and Ashley, you are up to speak, and it sounds like you have a clarification to make, so please do that as you introduce yourself and what you'll be talking about. And I'm going to also give you access to share your screen.
Perfect. Thank you, Kara.
I think what I'll have to do is make you host, and then you'll have to make me host again when you are done sharing your screen.
Sure.
Great.
All right, bear with me for 1 second as I pull this up. And as I do that, I have also brought with me today my colleague from the Maine CDC, Dara Fruchter. And Dara, do you want to introduce yourself while I pull up the PowerPoint?
Sure, thank you, Ashley. Good afternoon, everyone. I'm Dara Fruchter. I'm the project manager for infant and maternal substance use prevention coordination at the Maine CDC. And Ashley and I have worked closely on developing the first phase 1 implementation of Maine's Plan of Safe Care and all the other activities that surround that initiative. I do want to say that unfortunately I need to jump off the meeting after the presentation, but thank you again for having us today.
Great, thank you, Dara. And then just real quickly, my name is Ashley Olen. I am the Plan of Safe Care nurse for the Office of Child and Family Services. Thank you so much to Kara for having us today. I frequently am at these meetings as a participant, so it's fun to be able to chat with you all about our work today. And thank you to Kara and the whole board for allowing us to do that. One thing that I do want to clarify before we jump in is that Maine's Plan of Safe Care for infants, mothers, families, and other caregivers, though it is a part of the MOM grant and the MOM initiative that I'm sure you'll hear more about in the upcoming months, it is not tied to that. So it's not the only thing, it's not only in the MOM grant. So though we are a part of it and will be used in the MOM work, we are our own separate program outside of the MOM grant. We can answer more questions on that as well. So just wanted to clarify that before we start. But we will kick things off with Dara.
Thanks, Ashley. So the United States federal government requires every state to have a plan of safe care for infants substance exposed, their mothers, families, and other caregivers. The plan of safe care ultimately functions to make sure that these infants are supported, that their ongoing safety and well-being, best possible long-term developmental outcomes are the priority. The plan also serves to identify needed services and resources for the infants and their families and define the actions needed to align these. And while the state welfare agencies nationwide are responsible for federal data reporting, there is flexibility around who initiates a plan of safe care. A plan of safe care may be created prenatally or immediately after birth. Really, there's no wrong time to create a plan of safe care with a family. Although the best practice is to create it prenatally. We are currently in phase 1 of implementing Maine's plan of safe care. Federal and state legislation around plans of safe care. The Child Abuse Prevention and Treatment Act is where the plan of safe care comes from. The most recent amendment was in 2016, the Comprehensive Addiction and Recovery Act, which made changes to the plan around removing the word illegal to define substances, and also expanding the data reporting requirements to include caregivers on the plan of safe care. In Maine, Title 22 4011B defines required actions to support infants identified as substance exposed, and one of those is to develop a plan of safe care. And Ashley will take us through the timelines of phase 1 and phase 2 of our implementation.
Great, thank you. Looking at who's here, I know some of you have heard this presentation before or learned about plan of safe care before. So let's walk through what this timeline looks like. So we started in winter 2021. January 1st was our implementation date for all substance exposed infants in the state of Maine to have a plan of safe care that were notified to OCFS. And we started our education and training for the community partners, the 26 birthing hospitals, and pediatrics at this time. We talked to public health nurses, WIC, and other care delivery partners that may intersect with these families. We've continued that work, and as we know, Maine Mom will be starting in the summer. And so that is where some of these moms will start to engage with creating prenatal plans of safe care. At this point, we're doing some pilots at different hospitals across the state, starting with prenatal plans of safe care, because we know that if we move upstream to help families get supports and services in place prior to the delivery, there will be better outcomes. So that's the direction that we're moving. And then by fall, our hope is that many of the prenatal offices will adapt prenatal implementation of the plan of safe care. And when the families arrive in the hospital to deliver, they'll already have their plan of safe care created, and that plan will be updated for the infant. So our plan is that by winter 2022, plans of safe care will be started prenatally to increase that engagement, reduce stigma across the board, and make greater impacts for families. Long term, our plan is to have plans of safe care universally for all infants born in the state of Maine, regardless of substance exposure. So just real quickly, when there is a substance exposed infant that is born, there is a prenatal, as we've talked about, opportunity to create a plan of safe care. And as Dara mentioned, any time is really a great time to start a plan of safe care. But when that infant is born, the clinical provider, the social worker, or the nurse will meet with the family about the substance exposed infant and create a plan of safe care immediately after the birth. Though right now the plans are being created at the hospital, for the most part, it's a parallel process. They're not hinged together in the OCFS notification. So there will be a notification to OCFS, and a plan of safe care is also faxed to central intake. If there is a resource family involved in the plan, the infant is placed in the care of a kinship or foster family, the resource family would also get a plan of safe care. So at this point, the OCFS central intake will receive that notification, and through the process, a disposition will be determined by that supervisor. And at that point, concerns for abuse or neglect are brought into the picture. And what we find is that some of those folks will fall into that child protection investigation, where there will be an OCFS assessment and an open investigation. But the rest will fall into a referral to public health nursing, where they can engage with other services. And what we found when we looked at the data was that about 80% of the substance exposed infants in the state of Maine we're looking at no concerns for abuse or neglect. These could be families that are stable in MAT, marijuana use with no other concerns, or medication use during pregnancy. We also have the 20% that there would be an open investigation for things like active and illicit substance use, concerns for domestic violence or unsafe partner, or an open case for the OCFS. So that's kind of the breakdown of SEI notifications across the board for the state. And I know we use a lot of acronyms. So SEI is substance exposed infant. We've heard it be drug affected baby in the past. So if you're familiar with the DAB report, that would be what this is now. So what are some of the key elements of a plan of safe care? Well, we really would like this to move in the direction of creating it prenatally, as we've talked about, as we move to phase 2. We really want there to be patient engagement and built in collaboration with the families. As I mentioned, it's independent of the OCFS notification, though currently when it's created at birth, it's parallel to that. But we really want to move that upstream so the families have those resources in place. It's based in the strengths of the family, and we really want it to be accessible to the patient. So the mother can engage with her provider, the infant's provider, WIC, Maine families, public health nurses, and bring up the resources that they need that might be listed on the plan of safe care. So what does a plan of safe care look like? Hopefully some of you have seen one of these along the way. It's a front and back document. The front side is demographic information for the mom and the infant, the substance exposure, and then the current strengths and supports of the infant, of the family, and then also the needed assistance and goals. So really making this conversation about what's really working well and what resources do you need if you do have goals about going back to school. Well, what sort of resources or needs do you have around that? Do you need childcare? Do you need stable housing? Things like that. So really having a good conversation with the families. The backside is kind of a checklist of the resources that could be utilized by the family, and whether they need referrals or they're currently receiving that. And some of these things are appropriate to refer at the hospital newborn level, and some are better to be referred upstream when the family can have a conversation about early Head Start or childcare. But it's never a wrong time to do any of those. And again, some of them are really important to get in place. So if mom comes in for her prenatal visit and she is food insecure, we really want to make sure that that WIC referral happens. And this all coordinates with that Cradle Me referral as well. So the plan of safe care ties right in to those Cradle Me referrals that many of you are familiar with. Just some examples of this fillable form. Right now it's a paper copy. We're moving towards a web-based electronic copy that the mom could keep on her phone or the provider could log into to update. But right now, as we work on that program, this is kind of Plan of Safe Care 1.0. And these are some examples of, adding some of the resources for the family to get in touch with, and or having those conversations about where they could reach out to. And then this just shows engaged conversation of strengths, needs, and goals, and the Plan of Safe Care helping support that mother reaching her goals. So what's happened so far? So we started this in January, and now we can click that up to 5 months of Plan of Safe Care implementation. But this has been implemented at all 26 birthing hospitals across the state of Maine with significant training. Dara and myself and Dr. Carmack, who was mentioned in the first slide, she's the medical director of OCFS. We've had many trainings for prenatal providers, family medicine, pediatrics, and we have more to come as we move towards the MAT providers, prenatal providers, and the coordination with the mom program. Plans of safe care are being made across the board by social workers, physicians, hospital nurses, caseworkers, and public health nurses, and updated by them as well. So we've been able to have many opportunities to educate on the Plan of Safe Care, and those are listed below. So since the implementation at the start of 2021, there's been an increase from 55% of notifications of substance exposed infants that created plans of safe care in January to in April, we had over 90% of families with reported that had notifications to OCFS of substance exposed infants creating plans of safe care in the month of April. So we're really excited about the engagement and the hard work that everyone's been doing to get these resources and supports in place for these families. What we have really uncovered with the plan of safe care is that it's highlighted the common trends of referrals needed for families, such as housing, dental services for moms and families, mental health and substance use counseling, WIC, lactation support, parenting support groups, public health nursing, and Maine families. So really helping support getting those in place for these families. So when you're interacting with families, you can, and there's possible substance use in the family or in the home, or they have a substance exposed infant that you're working with. You can ask the family if they've made a plan of safe care and to share the document with you. And if they haven't made a plan of safe care yet, you could discuss the benefits of a plan of safe care, because there really isn't any wrong time to create one, and anyone can create a plan of safe care with the family. So you can discuss their plan of safe care and support connecting them to needed resources that may not be in place yet. You can consider engaging them with an RN or an MA, or that are part of case management or social work to assist with the process. Encourage engagement with public health nursing, families, and WIC. And I know some of you are representing those entities today. Update the paper copy of their plan of safe care, and if there's been any change. And the biggest thing to remember is the plan of safe care is active until 12 months of age. So from birth until 12 months of age. And it covers not just the mother, but any members of that immediate family can have referrals or resources documented on the plan of safe care. Dara, would you like to talk about the documents?
Sure, absolutely. So we have a plan of safe care, a document for mothers, infants, and families. And then in the event that an infant is discharged with a resource family, a plan of safe care should be created with that family as well, because they are also eligible for resources that they may need while they're caring for the infant. We've developed a plan of safe care checklist, which is currently on our plan of safe care webpage on the maternal child health site at the Maine CDC. And we're working towards having recordings of plan of safe care education and training available, along with frequently asked questions document, a scripting document. We're looking to develop a plan of safe care toolkit as well. And coming in later this year and into early 2022, we will be implementing phase 2 of our plan of safe care. As Ashley said, it will be implemented prenatally at that point. And we're also currently working on developing a data portal and a locator tool. So there's much more to come around support for the plan of safe care work. Ashley, do you want to talk about our office hours?
Sure. Some of you may have just got an updated invite to this because our other one dropped off the calendar. So we've extended our bi-monthly office hours through the end of the year. These happen on the first and third Fridays of the month from 1 to 2 o'clock p.m. And this is just a great opportunity to get some introductions and announcements and updates around the plan of safe care. But really, it's an open forum for questions and discussion and an opportunity to discuss successes and challenges in implementing the plan of safe care at any level. And time will be spent being able to collaborate with the workflow, create clinical workflows, and hear what other hospitals, other prenatal offices, or other public health nurses are doing around this. It's just a great opportunity. And We have really enjoyed the conversations that we've had. It's been an excellent opportunity for us to not only help support different stakeholders in the conversation around plan of safe care, but also for us to learn more about the challenges of connecting families to resources in various geographical locations across the state, and learning more about individual resources. It's been a wonderful resource, and I know that Dara and I have really enjoyed and benefited from these office hours. So the next one is actually tomorrow. So if you'd like to join us, we'd be excited to have you. And that is it. We're more than happy to have an opportunity for you to ask questions. I will give Kara back hosting privileges, and we can chat a little bit more about plan of safe care. I know some of you have heard this multiple times, and some of you, this might be your first opportunity to hear about the plan of safe care.
I have a question, Ashley.
Sure.
Thank you so much, first of all, for presenting to you and Dara. Thank you. You had mentioned that one of the things that you had discovered was that there's a need for lactation services or referrals to lactation and support groups. Have you been able to have you been able to make those connections happen, or do you feel like there is a gap that the Breastfeeding Coalition could help with, or that anyone here on the call could help with? Do you need more resources listed that you could share? What are some ways that we could help with that?
Yeah, I think that's a great question, and I purposely put that one into for this group because I knew that there would be opportunity to connect with folks who had a lot of great resources at their fingertips around breastfeeding and lactation support. And we do need resources. So anything in your geographical region that you find as a great resource, we would love to hear about. Different parts of our DHHS agencies, especially the Family First program, are putting together some resources. And then also the hospitals and the prenatal providers are always looking for opportunities to connect families to resources. So anything that you can share with us, we're more than happy to pass along. I think it's a great opportunity for us to be able to connect with all of you, and part of the reason that we wanted to come and chat with you all today, so we can get more families connected to those breastfeeding and lactation supports around the state, especially outside of our bigger areas of Bangor and Portland. So I will put my email into the chat, so you feel free to email us or we can always meet at any time. And we're more than happy to chat about how we can do a better job of connecting families with resources and providing those resources to the folks who are creating plans of safe care with these families.
Excellent. That's great. And we do something we've started to do the last few meetings is create a shared document of what people are sharing. And so I'm going to put that in the chat box as well, so that anyone can add to it. I did keep the virtual group information that was in there from the last meeting. We have the Maternal Health Alliance of Maine, Maine Medical Center groups, and the Leachy League groups are listed there. But if there are other groups that you know of, or other community lactation resources maybe that you know of, and that could be a great place to put that right in that document. So hopefully people have access to that. I will go through during the second part of the meeting to share the things that I've added. But it's good to have. You all have access to edit it and to share it as well after the meeting.
And I would just encourage you to ask if you work, with any pediatric practices, or if you're working in conjunction with any prenatal offices, to engage them about the plan of safe care, talk about the plan of safe care, see if they started working with families, because we are looking to chat with more practices, more prenatal practices, more pediatricians about the plan of safe care. So when it does trickle down to the pediatricians, that they are ready to discuss this with families, and it's, we continue our outreach. So any help we can get would be great. But thank you so much for having us. This was wonderful.
What other questions or comments? Has anyone here seen a plan of safe care yet, or worked with a family who has used one? Anything that you want to share about that experience?
I hope some of the public health nurses have at least seen one.
Well, my name's Catherine. Hi, I'm a public health nurse, and I haven't seen one in action yet, but I was really excited to see the back of it because it made me think, geez, I wish I had that in my hand all the time with moms, because it would be a really good checklist, because it's like all that stuff is what we do with moms anyway, if they, no matter who they are, it's that's a nice list to be able to go off of and really, in an organized way, say, what are your needs? And look, we can have them on paper and go through them goal by goal. It's really, I think, probably helpful to have a tool that offers, it's really great to get to go to work in people's homes and get to go off what their goals are. But sometimes people don't know what their goals are. And when you're offered a paper that says, hey, well, let's go through and see if any of these might be some good goals, I think that's cool. I think that's great for everybody. So that was nice to look at.
Great.
Catherine, I'm going to put it in the chat again because you can download the form, and I mean, you could just use the resources on the back.
Great.
And there's a fillable one too, so you can type right into it or you can handwrite it. So either way, and you can create them prenatally with your families if you're working with anyone prenatally. We've had a few come in from public health nurses that were created prenatally, and then we can't get them at OCFS until they're sent through, like with a notification when the infant's born. But you can create them, hold on to them, and then say, bring this into the hospital. And this is why when we do have the electronic web-based form going, this is going to be all smooth, because you'll be able to type that in, you'll be able to have that conversation, and automatically will be available to that hospital when the infant is born. So I'm so excited. If you do get a Cradle Me referral to a public health nurse, if they've created a plan of safe care, then there should be one attached. And I see Jessica nodding her head. Hopefully I think you've seen one, right? I think we've talked.
Sorry, I was trying to unmute myself. Yes, I've received a few of them, and find it, like Catherine said, it is what we do typically. And so it's a very nice list, and it's helpful. Yeah, I think it's a really great thing. It's important work. I think my biggest maybe stumbling block with it is that it does feel connected to OCFS for some people, and that scares some people, and so there's that piece. But we, as always, we work with moms and are very open that we're there to be supportive and do the best we can with that. So
yeah, I think that's a really important point to bring up, is that's part of our messaging, is that the plan of safe care is not to be punitive, it's to help and support families. That's why we are connected so deeply with the Maine CDC, and making sure it's a joint effort, that it's not a punishment for these families for using substances during their pregnancy, but as a support. And as we said, we're really looking forward to when we can make this universal, that it's something that all families can get to. We know a lot of families that have a lot of needs that aren't using substances. So hopefully that is the directions that we will be able to go in. But yeah, that's one of our challenges for sure. And we're looking to kind of educate more on that. Most substance exposed infants are not involved in an OCFS notification, that it's 80% that are referred to public health nursing, and that don't have that deeper investigation with OCFS.
Yeah,
thank you so much.
Share that, Ashley. Thank you for sharing that. And it really does seem like the focus is a strengths-based one, like you said, and the goal is to reduce stigma as well. I heard you say that. And one thing that I have in that new knowledge worth having document that I'll share is a great perinatal implicit bias training opportunity. And I'm wondering, is that something that's been happening for OCFS or for anyone that you've worked with? What kind of training around reducing stigma or implicit bias has has been happening specific to substance use, I suppose.
Yeah, I'm not sure exactly outside of this program, but I think it's a great opportunity to explore and to see what training has been happening across the agencies. And I think that there has been some, but I can't speak to it. I would definitely be excited to look into the opportunities, because I think that that is, something that we all have to pay attention to. And if you, oh, sorry, Kara, I was just going to add one more thing. If you stay up to date on the Plan of Safe Care website, we are currently updating the forms. We've gotten a lot of feedback over these last few months of what can streamline the process a little bit, add and subtract some of the fields, what is missing on those referral lists, or what is never used. So in the next couple months, we will have an updated form as well that hopefully will be more user-friendly for those filling it out or updating it. So we're excited to see that implemented as well. So stay tuned.
Awesome. Thank you. And I don't know if you saw in the chat box, Lynn House said that they initiate at Penn Bay. Lynn, I don't know if you want to unmute and share any more about that, or if you just wanted to mention that.
I would love to hear more about that.
Yes, it has been, it's nice having the forms are very, very helpful, especially the Plan of Safe Care implementation checklist. I mean, it's just nice to have everything sort of lined up before you call DHHS, and doing things, with sitting down with the families. I mean, I think that's the biggest change that I've seen, is because we have been mandated reporters for families dealing with substance abuse, but I don't think we always took as much time to sit down with the families as we do now. So I think that's a real improvement.
That's great to hear. And that's one of the bonuses of being able to share the Plan of Safe Care at groups like this, to hear that feedback. And I definitely encourage you or some of the folks from your team to come to the office hours so we can hear some more about those opportunities, because we're excited that there's increased conversations. And then then we know that there's other things that are challenging, because sometimes when you go through that list, you are bringing up some really important needs that are hard to get in place. And so now we've identified this for a family, and now our role is to support them in finding that. And sometimes it is difficult. So it is kind of opens a can of worms, but in a good way. And we're excited to help families navigate that, but making sure we continue to find those resources and help the families get connected to them. But we're excited about how it's going so far.
So you said you'll add your email address in the chat box, and I don't know if you want to put in those office hours in there again too.
Absolutely.
And do you have any sort of mailing list or anything for people to be getting updates if they are interested in subscribing to updates? Or
yeah, I think that would be a great idea. If you're interested, feel free to throw your email into the chat, and I can add you to my email list around any updates, or a lot of our updates we do at the Plan of Safe Care office hours. So if you're included in that list, you'll get those updates.
excellent.
Thank you so much, Kara. Thank you so much to the coalition for having us today.
Yeah, thank you. I want to mention, I think we do have some folks here from Maine families. We usually have a lot more, but I believe there's a conflicting meeting or training happening right now. But this meeting is being recorded and will be put on our YouTube page for anyone to view after. Some people had emailed saying that they were interested in hearing you speak and wanted to watch it after. So that will be an option. Thank you. And then I don't know if you do have anything to share about the maternal opioid model that might be good if people were wanting to learn a little bit more about that. If you have any info, I did have a link in the email for people to go to the website. I can put that in the chat box again for if people want to learn more that way. But if you have anything, or anyone else on the call has anything that they want to share about that, then that would be good in these next couple of minutes too.
Yeah, we're excited for the mom initiative to start. I might defer to Amanda on that a little bit more, just because I want to make sure that she probably has a more recent pulse on the situation. I work a lot of the mom stuff that's directly related to plan of safe care. So, but we are getting close to the initiation and the different hospitals that are going to be implementing the mom model. So I will defer to Amanda if she has anything to share. If she's okay with that.
You put me on the spot. Yeah, no, that is my job. So I'm the vice president for this, but I also work at Maine Health as a program coordinator for the perinatal substance use disorder program. And we are working on the Maine Mom model. So July 1st is when all the sites are going live with that. And what that means is it's an integrated model of care. So we're trying to get practices to provide IMAT, so medication assisted treatment, along with the prenatal visits, and have kind of relationships with IMAT providers. So a lot of people were picking, prenatal visits, IMAT visits over prenatal and missing out on that care. So we really wanted to work on a model that creates that integrated version. And then there's lots of different parts of it, but plan of safe care is another part that we're kind of collaborating with on that. But yeah, so that's going live July 1st. We've been working with all the Maine Health sites for that.
Awesome. Thanks, Amanda. Any other questions for Ashley or Amanda? Well, thank you, Ashley. I know you have to run at some point. If you're able to stick around for a bit to hear who else is on the call, that's great, but I understand if you have to be somewhere else.
Yes, I think I can hang out for about 10 more minutes. But really, thank you so much for having us. And if anyone has anyone else that they work with that would benefit from hearing about the plan of safe care, we're more than happy to pop into a MCH meeting or come to your monthly meeting. We are excited to share about the plan of safe care. So if there's anyone that you think would really benefit from hearing about this information in the program, please let me know, because we're happy to chat. So thank you again so much. Thanks, Kara.
Great, excellent. So we're ready to move on to our next part of the meeting, and that is going to be Amanda. We have 1 minute to stretch. If you'd like to stretch, and feel free to turn off your cameras, grab some water, grab a snack, whatever you need, but we're gonna jump into this next part here. But obviously with any meeting, do whatever you need to do for yourself in this next part. So Amanda, I will leave it up to you.
Great. Hello. Amanda Powell, like I just said, Vice President for Maine State Breastfeeding Coalition. And so I guess I want to go down the list, but I feel like maybe people are taking a stretch break now. So do you have anything, Kara, that you want to share first, or would you rather go last?
I can go now. I was just going to add that Maine Mom, I was going to add what's been put in the chat box into this document. I'll put this back into the chat box too for people to see. And then I'll try to keep it updated as we go along. And also I will re-add the strategic plan into the chat box. If you weren't here at the beginning of the meeting, we're asking for some feedback. And that is a PDF of the plan there. And then we're asking for feedback through a link that I'm going to get back to here. This one will work. So yeah, we just are really looking forward to some feedback there. And then let me see if I can go ahead and share my screen so we can look through that document. All right. Great. So can you see the Google Doc here? Everyone's
Yes.
okay. So this is the training I was mentioning. diversityscience.org is a website to check out. I learned about this through the Breastfeeding LA email list. They have a large breastfeeding coalition, and they had mentioned this opportunity. So it's an implicit bias and reproductive justice training for perinatal providers. And they have a lot of other resources and options on their website too. I also learned about this Health Connect One breastfeeding advocate training, a virtual breastfeeding advocate training. And this looks really great. They will award up to 80 individuals serving birthing communities of color and or people identifying as people of color the opportunity to participate in the training. And I clicked on the link and saw this kind of fine print here, that they have a limit of 26 to 28 people per cohort. There are 3 cohorts, 3 training sessions, and they'll be giving priority to people who are under 40, people of color, people working in non-clinical and non-traditional settings, and people serving and or living in underserved communities in those states in particular. So I almost didn't share it because Maine's not listed on that state, on that list, but who knows? Maybe they have plenty, they will end up having plenty of seats available, but I think it's something that's worth looking into and sharing with anyone you know who might be interested in applying. One of the things you may notice on our strategic plan too is we would love to have a scholarship program for Black and Indigenous people of color to attend certified lactation counselor trainings or any other kind of breastfeeding training that will help them support people in their communities. So that is something, fingers crossed, we would like to offer in the next couple of years. So it's great to learn about trainings like this that we could look into. Also, perinatal outreach, we have more webinars coming up. There's nothing in July. Previous webinars have been recorded and should be available on the perinatal outreach website. In August, on August 4th, there will be a stillbirth webinar, and I will be speaking a little bit about bereavement donor milk donation. I'll be doing a webinar on milk supply September 1st, and November 3rd, there'll be a webinar about perinatal mental health treatment and lactation with Dr. Lior Rabin. And then also, I don't know if anyone saw this report from the CDC about racial and ethnic disparities in breastfeeding. And you might not be able to see this very well. I'm not sure how much more I can zoom in. Here we go. And I just copied and pasted or did some screenshots, but they were looking at disparities of breastfeeding initiation. And in the United States, they found that the largest disparity was 16.7% between different racial and ethnic groups. And in Maine, we were under 10%, 9.5%. And it looks like the biggest disparity is between people with Asian ethnicity and American Indian or Alaskan, American Indian or multiracial groups. So that's interesting. It's a report that might be worth looking at and something to consider how, what else could we be doing to support all people of all racial and ethnic groups. And this is just another visual of the disparities and that's in that report. It also shows the longer line shows the breastfeeding initiation rate, and then the darker line shows how large the disparity of the largest disparity in that state. I mentioned that I kept the virtual groups listed here and also Bangor's social media page that was listed before. And then legislative updates. Let's see. Actually, I'm going to turn this over to Brooke. It looks like she added a lot more here, so I'm really happy to hear that. Brooke, are you available to unmute and share more about legislative updates? She had mentioned she might have to pop off.
Yeah, I don't see her.
Okay, to go actually help with voting. Brooke Barron is on our board, and she's also the policy expert or policy analyst for the Speaker of the House. So she is, they're in session right now and busy, so I can look through this. So legislature returned to the State House yesterday for the first time. There are 1,100 bills that have been considered by the committees. That's so many. And are waiting to be voted on by the full House and Senate. So they hope to adjourn by June 16th So they have 9 days left to go to vote on everything. The bill around paid leave, which was to create a commission, it did pass through Labor and Housing with bipartisan support. It will be voted on in the next couple of weeks, and it was voted out of committee as ought to pass as amended. There were 44 items of public testimony that were either sent in as written or were given orally. And so that so far it feels like a big success. And we'll be learning more about what that commission might look like if it does get passed through. And then donor milk, an act concerning Maine care coverage of donor milk, was passed by the House and the Senate. It's now on the appropriations table. And so they need to decide how to divvy up any funding left over in the budget. And so the price tag for this bill is $157,000 a year, which is pretty small compared to a lot of other bills. It could be funded off the table, meaning approved for funding by the Appropriations Committee. And if so, it will have another vote by the Senate and onto the governor's desk to hopefully sign into law. I've been in touch with, I think I mentioned this before, Naomi from the Mother's Milk Bank Northeast to look closer at that to see if is that an accurate estimate. And so I think if there are any concerns, there might be some wiggle room with that. It looks like Brooke is rejoining, so I will let her actually, and that's the last part of my document, but I'll let her take it from here. Welcome back, Brooke. I just went through the legislative updates, but if you can actually share, I went through the donor milk one, but if you want to explain the appropriations piece of that again, that would be great. And then also share the postpartum care bill, any information there.
Yes. I was just connecting to audio when you were starting to talk. Kara, did you say you'd already talked through family leave?
I did, yes.
Okay. So the other two bills that we're talking about, I wrote 865, but it's actually LD 85. So that's the bill to provide reimbursement for donor breast milk for people on Medicaid or Maine care. And that has been passed through the House and Senate for its initial votes. And so now it's headed to the appropriations table. So what that means, and I'm happy to answer any questions about it, that's where all the bills that have a price tag end up. And once the legislature basically finishes all its work, the Appropriations Committee takes a look at what bills need to be funded. And there's going to be way more bills with big price tags than they'll ever be able to fund. So they'll make decisions about what there's still money left over to do and what there's not. So the donor milk bill has price tag of $157,000, which is quite small in the scheme of things. There'll be bills that have a $500 million fiscal note, just for reference. And there'll be, I think last year there was something like, or 2 years ago, something like $8 million to split among all the bills. So it's a big question mark how much money is going to be left over this year. There's a lot of moving pieces with federal funding. So TBD. But if the Appropriations Committee does choose to prioritize this bill, the donor milk bill, then it will have one more approval vote by the Senate, and then it will go on to the governor's desk to be signed, hopefully. And LD 265, an act to provide women access to affordable postpartum care. This is a bill I've mentioned before. It expands Medicaid access or Maine care access for low-income women from 60 days after giving birth to 12 months, I believe. This is something that was a provision in the American Rescue Package or Rescue Plan, the big ARP COVID relief plan that US Congress passed, basically made it easier for states to do this. And the federal government would pick up, I think, about 3/4 of the tab. So it's in a similar posture where it received positive votes in the House and Senate, and will go to the appropriations table. That will likely happen at the very end, so probably in about 2 more weeks, June 14th, 15th, 16th. Will probably be when those appropriations committee decisions are made.
Awesome.
Great. Thank you for sharing all of that.
You're welcome. And one more thing I'll say is normally there's a constitutional deadline to finish the work by a certain date, and it would be June 16th. This year it's a little bit different because we actually already adjourned and then came back. It's not really worth going into, but we're still trying to hold ourselves to that June 16th deadline, but sort of as tradition, and because a lot of people have planned their lives around that date, since it's a citizens legislature and people have other jobs. So the legislature will probably be in session until the 16th, but it might go a few days later. So all of the dates that I mentioned before could be pushed back by a week, but probably not any more than that.
Great.
Well,
Okay, so
Sorry.
go
While
ahead,
you're
Kara.
thinking, Brooke, is there anything else you want to share? Do you want to introduce yourself? I don't know if you've officially introduced yourself.
Sure. Hi, everyone. I'm Brooke Barron, and I'm a board member. And I also work in my day job as a policy advisor to the Speaker of the House of Maine. And we just came back into session in the State House after meeting the Civic Center for most of this year. So today's just the second day back. So thanks for bearing with me as I've been popping in and out. But it's great to be here.
Great. Thanks, Brooke. Okay, so I'm going to put in the chat just what you can say when you go around. So your name, organization, and if you'd like to share your pronouns, and then really anything that's going on that's new that you want to share, or any questions that you have, challenges that you're facing. This is a great time to share. So I'll just go down the list, and if you don't have anything, that's fine. You can just say your name and organization and pronouns if you'd like. So we will start with Allison M.
Hi, Allison Marco from the WIC program, Maine General WIC, serving Kennebec and Somerset counties. I don't really have challenges. The good news is that we're finally, after such a long time, going to start opening our doors on a regular basis to having some of our clients come back for in-person appointments. So we're really excited about that.
That's great. Okay, so, and then we have, I'm not going to say your last names because I feel like I messed them up. And so I'm saying the first letter because I want you to say it correctly to the full audience. So Amanda R.
Hi, I'm Amanda Rosignol. I am from Western Maine Community Action's WIC program. So we serve Androscoggin, Franklin, and Oxford counties. No real challenges here either. We've also have been back to seeing people, so it's been really nice having our families come into the office again, and being able to see our babies has been nice. We recently hired a new breastfeeding peer counselor, and she started when on maternity leave and recently just came back. So we're really excited. She's been great. So we're just working on, supporting our moms.
Great. It's so exciting to hear that, people are coming back into the office.
It's great.
It's great for, someone like me that's an extrovert. I'm loving all the new people interactions. And then we have Amy B.
Hi, everyone. Happy Thursday. I'm Amy Van Haren. I am part of the MSBC board and the founder of Pump Spotting. We are a breastfeeding technology company here in Maine. Man, I feel like there's just lots of momentum happening. The USBC conference is coming up and the Pump Act. And I don't know, I feel kind of excited right now about all the breastfeeding momentum and support and conversation that's happening. In particular, we're really excited about supporting companies in the workplace. So I feel like there's a lot of dialogue happening there, and I'm excited to be expanding that. Which is good. I think we still have a ways to go, but I get very passionate about what's happening and how we can all help employers do great things for their parents. So that's exciting. And the only thing on my mind, something that we're doing, is we're actually going to be launching a collection, a collaborative of employers to really celebrate and honor those in the workplace that are doing things to support breastfeeding friendly services. And so we're in the midst of putting that together, but this group, if you know employers who are already doing great things to honor or celebrate, might be fun to hear who those companies are so we could think about promoting them. Hey.
Amy, I'm curious if there's anything going on with the Breast Express, and if there is, if you want to explain to people what it is.
Yes, I own a 40-foot RV called the Breast Express that we turned into a beautiful nursing and pumping oasis. Her nickname is Barb. She loves getting out and supporting communities and mothers, but she's been at the spa in Sacramento during the pandemic because we can't be on the road. So our goal is to get her back on the road in 2022. So stay tuned.
Yes, I was supposed to be on that bus, and then the pandemic started. All right, so Dr. Allie, would you like to share?
Can I ask Amy first to either share a little more about what you are doing for working moms, and then maybe put in the add to the document? Or either way, you can either share more now, or you can type a little something or put any hyperlinks or anything that might be helpful there.
Sure. Yeah, I'm happy to. So what we've done with Pump Spotting is created a one-stop support space for employers. So essentially with the Pump Spotting platform, we're making it easy for employers to think about breastfeeding support beyond spaces. So as part of that, we help them think about their policies and looking at their spaces. But with Pump Spotting, we connect parents within a workplace. We input all their mothering room and lactation spaces so that parents can check in, they can find them easily. They get access to lactation consultants and all the content. So it's kind of like a one-stop support portal that companies can bring on board and then offer to all their employees so that they have a space to find community and support and connection and all of that. So I'll put the link in the document, and always love to talk about the workplace and connect with people. Thanks, Kara.
Great, thank you.
So hi, my name is Allie Kopelman, and I'm a pediatrician who recently opened a private practice called Personalized Pediatrics of Maine. I am a CLC and hopefully am an IBCLC. I'm waiting for the results of the test. And kind of the most exciting thing going on right now is that in collaboration with the Mother's Milk Bank Northeast, we're going to be opening a new community milk depot / dispensary at my office. And the grand opening is June 18th at noon. And it is open to the community. And I'd love anybody to show up who can show up. I haven't had an opportunity to meet most of you, and I'd love to. And I'd also love to show off the space and just to create a community of like-minded people. There is currently a breast milk shortage, so the dispensary part won't be open until July, but there are going to be several women dropping off milk for the donation part of it.
Great, I just put that Facebook event in the chat for you. Let's see, your names keep moving around. Ellen K, would you like to go? Oh, you're on mute, Ellen.
There we go. Thanks, Amanda. Ellen Kunkel. I'm a childbirth educator at Maine Medical Center. I'm a doula, and I'm the Vice President of Outreach of the Maternal Health Alliance of Maine, which I'll talk about in a moment. But at Maine Medical Center, we're teaching all of our classes in the childbirth ed program remotely, and that's ongoing. We don't have an end in sight for that. A lot of it's pending on opening up visitors to the hospital, which isn't happening yet. And I run a new parent support group called the New Parent Circle, and we meet Thursday mornings free of charge. Folks just need to register online, but it's for new parents and their babies. They can join prenatally, or they can join, anytime. I mean, I have a mom whose baby is 16 months old, but most are younger. So to connect and share peer support. Thank you, Kara. She put the link in. Kara also runs through the same program, the breastfeeding support group. So we're looking to increase our attendance at our groups. I think it's a little challenging because people need to go online and register, and then they're sent the email with the link, which is kind of standard. But yeah, it's just a little bit hard for new families to want to take that next step. So if you know of anybody who would benefit, and they don't need to be, having birthed at Maine Med, and they don't need to be in Maine. I mean, we have people taking our classes from all over the place. So they could also be somebody from another state who's in the support group too. Eventually they will go back to being in person as well. I think that's kind of it for Maine Med. And I did just want to mention the Maternal Health Alliance of Maine. I think I mentioned that at the last Breastfeeding Coalition meeting that I attended, but we are a nonprofit that was founded 7 years ago, working to support, educate, and increase awareness around perinatal mental health issues. And our big activity is offering online support groups. They're free of charge. They're every Saturday morning. And I will type the info. Oh, thank you, Kara. Kara just typed it into the chat box. So folks need to go online and then register for the support group, and then they will receive the link to join. But it's run by a trained volunteer, so it's peer support facilitated by Hannah Lamprey. She owns the Fourth Trimester Collective. She's amazing. So that's happening, and so feel free to send anybody. They don't need a diagnosis, they don't need a referral or anything. It's just self-referred. Anybody can join who's having struggles. And also we're having an event, and I will type that in. It's called Climb Out of the Darkness, and that's an event that's put on by Postpartum Support International. So it's all across the country, and it's not currently happening. It might be in Canada. I'm not sure it's happening in any other countries, but the organization is international. But the event, what we're doing on June 26th is at 11 a.m. meeting at Fort Williams Park in Cape Elizabeth, and having a couple speakers, having some kids activities. We're having one of, a bubble machine and things like that. And just a place to come together and to honor and celebrate and meet and support as well too. So anybody who would like to come, you're all welcome to come to that. And it is a fundraiser, but that's not our full, our main thing is to bring people together and be more visible in the community as well too. So 11 a.m. I think it's 11 to 1:30 on Saturday, June 26th. Just come and have fun, picnic and hang out. We're gonna take a little walk, and we're gonna paint rocks with either things that people want to let go of or things people want to bring into their life and throw them into the ocean, things like that. I think we're gonna paint, think about environmental on that one, but yeah. So anyhow, we've got some activities up our sleeves. So thank you.
Thanks, Ellen.
Sure.
Isn't that also the group that does the run?
Yes. Well, we've always done the, I'm forgetting the name right now, but a 5K. So this year we're not doing the 5K. We decided to jump on board with the climb. And Amanda Brown up in Augusta, who's part of PSI and runs a support group and so on up there. She's always done the climb from Augusta. She's not doing it this year, but she's gotten a good attendance. So we're not doing our 5K this year. We want to promote more connecting, educating, and supporting. So it's not simply fundraising. The 5K was.
Okay.
Yeah.
Great.
Thanks.
Thank you so much for all that. Next, there's somebody on an iPhone, or if you're able to unmute and tell us your name, organization. Okay. Well, if you want to at any time, let me know.
That may be me.
There we are.
Hi, I'm Ambrosia Ross. I work with WIC up in Washington County, and I am the breastfeeding peer counselor up here. And this is Miss Charlie.
Oh my gosh. So cute. Great. Did you have any updates or challenges or anything that you wanted to share?
I don't think there's much going on for me. I'm just coming back from maternity leave, and so it's been fun getting back. I did have a great conversation personally with the I'm not sure what her job title is, but the essentially quality control at Downey's Community Hospital up here. I just had surgery recently, and the anesthesiologist is still giving outdated information when it comes to breastfeeding after surgery. And looks like they're going to be working on fixing that. So very exciting. If anybody wants to call them and encourage that, that'd be wonderful. But otherwise, I'm excited.
Great. Do you mind saying just your name and organization again? So I can
Sure.
add it to the minutes.
Yep. I'm Ambrosia Ross, and I'm the Washington County WIC breastfeeding peer counselor.
Great. Thank you so much for sharing and showing us your baby. We love babies on the screen.
Mm-hmm.
All right, so then we have Gemma. Gemma P.
Hi there, I'm Gemma Penberthy. I'm the Public Health Nursing Supervisor for Cumberland and York counties for the Maine CDC. And I am just very happy to be here and to see some familiar faces and meet new ones. We are, I think the biggest challenge is the challenge that everybody has been having, which would be the pandemic, but I think we're coming out of that. Our public health nursing team was redeployed, a really good portion of it was redeployed to help with, to really focus on the pandemic effort. And we are coming back from that, which is really delightful. And we are just very happy to be able to re-engage with all of you. So thank you.
Great, thank you. And then Jen V.
You said V, right?
Yes.
Jen Vijay, York County Community Action. I'm the breastfeeding coordinator and the office manager of Biddeford. Nothing too exciting with us. We have started seeing some folks in the office, not a lot at this point, but we are making that starting to make that process change. WIC is also providing $35 a month of fruits and vegetable benefit for participants over the age of 1. And those are going to be the months for June through September. So we do have a lot of things that are positive about that. A lot of clients are super happy about receiving that added benefit. So we've had some people even reapply because of it. I think that's about it for us. Nothing too exciting on our end.
Great, thank you. And Jessica M.
Hi, I'm Jessica, and I'm a public health nurse. I work with Gemma and Catherine, who you'll meet later. And we go into homes, and that's kind of our breastfeeding connection is doing a lot of training in the home. And I haven't gotten to do it for a year and a half with COVID. So I am very excited to be back. I did a lot of COVID work. So I'm actually starting my CLC training tomorrow, and looking forward to that.
Great. Yeah, it's a really good training. I took that many years ago. So I remember ferociously writing everything down the whole 40 hours I was doing it. Okay, and then Catherine F is next.
Hey, thank you. My name is Catherine Fortin, and I'm also a public health nurse. I cover, well, I'm out of the Portland office, so I kind of cover York and Cumberland counties, but I usually get families in the Brunswick area. But for this last year, I was one of the nurses that actually continued doing maternal child health offerings of support, which was actually over the phone more so than in person. But I got, I was able to, and I'm starting to be much more flexible now, but, being able to offer walks with women, or I've been able to find ways to still connect with women, making sure they have resources and, bringing food to certain families, throughout the whole pandemic. So I have had some in-person visits, but this whole year, most of it has been over the phone, and which is changing now. But we get our referrals through the Cradle Me referral system, which is still really kind of complicated to understand because, just as it does sometimes change with, different government leaders. But our governor is very supportive of this program and the work we do. And so, this is, I work with moms of all, and families of all sorts of backgrounds, and it's really not limited. So I can get a referral for anybody, and it goes through the referral system, and it will go to a public health nurse. And I do, sometimes just one visit with a family if that's what they want, or one call. But I can also do, a lot. I can do, I can say, hey, I can stop by every other week for a period of time, whatever that wants to look, whatever that looks like for you. And we work on resources, and we work on breastfeeding, and we work on support, a lot of mental health support. Really at that point when you're one-on-one with somebody. I work a lot with new Mainer families. I feel lucky when I get connected with them, really lucky. And I just get to learn so much from listening to women in my role. I've very recently been kind of pulled back in during the pandemic. I was taken off a project that I had started looking at about a year and a half ago, and that's kind of working on the MCH work plan grant. And so I was very appreciatedly connected with Kara, and hopefully moving forward, we'll get to work together and kind of collaborating on that. And that's how I got here. So I really appreciate that. And I appreciate all the work that everybody here is doing, and just look forward to the continued connection. Yeah, so what I do is also free service. So if somebody wanted a little extra support, the referral can be filled out by anybody. It could be filled out at a doctor's office, or, a mom could fill it out themselves. Anybody can fill it out and submit it. And the way it works is you are supposed to receive a phone call after that, 3 phone calls before we, would go on to another person or next people. But yeah, it's a free service, and I love doing what I do because I get to support women and kind of look at it as an opportunity to empower women. And I mean, what's better than that?
That's great. Do you also get 211 referrals? Referrals from 211?
211. Yes. Yeah. We can get referrals from 211. They can, yeah, I mean, I get prenatal moms, I get postpartum moms. Usually I feel like they come from hospitals, like right, in a labor and delivery unit, which is kind of fun because I used to work in Fort Kent, Maine, which is way up north, and I used to fill those referrals out. And I can remember when it was a different administration with the LePage administration, and it was like all of a sudden, before it was like every mom would get the visit offered to them, and all of a sudden it was being kind of restricted a little bit. And it's nice now again that it is offered to every family that desires it and wants it. for support. So I really appreciate that.
Yeah, that's great. Well, thank you. And next is Kelly. Kelly B.
Hi, everyone. I'm Kelly Bowden. I'm the perinatal outreach education coordinator. I'm a nurse with a background of working in the NICU. And, you know, COVID has been a challenge in this work, just trying to stay up to date with all the information and research and all the logistics around pregnancy and breastfeeding and COVID. So other than that, I think I continue to get a lot of questions about marijuana and pregnancy and breastfeeding. And I wanted to mention there's a conference coming up. It's a virtual conference. It's free. It's part of the Northern New England Perinatal Quality Improvement Network. And the keynote speaker is Dr. Mary O'Connor, who's a pediatrician and who was one of the co-authors on the American Academy of Pediatrics statement on marijuana and breastfeeding. So topic that I thought many of you might be interested in. I'm sure you're bumping into this too. Thanks, Kara. Just put it into the chat box there. And there's many other great topics related to pregnancy and newborns. So I'd encourage you to take a look at the agenda. And again, it's free. And the collaborative is made up of hospitals throughout Maine, New Hampshire, and Vermont. It includes physicians, midwives, nurses, basically anybody who works with pregnant and breastfeeding women, newborns is welcome to attend. Other than that, we've had a statewide project working on regionalization of care and clarifying levels of maternity care and levels of newborn care so that moms and babies get the care that they need in the most appropriate location whenever possible. So I'm happy to answer questions about that if people have them. Otherwise, I think I'll just stop there, but I'm happy to chat with anyone.
Does anybody have questions for Kelly around any of that?
I just want to add, thank you, Kelly, so much for mentioning the NEPQUIN conference. One of the topics is on prenatal education too. Well, so there's other perinatal substance use and then prenatal education, novel approaches to prenatal education in the digital age. So I'm really looking forward to hearing that. Ellen, it looks like Sharon Economidis is going to be speaking.
Great.
On that, and others from Maine Medical Center. So that one looks really interesting. A lot of these topics look great and it is free and registration looks like it's still open.
Do you know if it will be recorded? I have my support group in the morning.
Yeah, they do record the presentations, and if you registered for the conference, then you'll get an email afterwards with the handouts and the recordings. So I would recommend you go ahead and register, Ellen.
Great, thank you.
Yeah.
Yeah, that's a really great conference. Okay, next we have Lindsay M.
Hi, I'm Lindsay Matsopoulos. I'm the breastfeeding coordinator for the WIC program at the Opportunity Alliance. So we cover Cumberland County. We don't have a lot of new updates. We're all doing telehealth for now and just seeing clients in the office for things like breast pumps or formula pickups. But we're working on transitioning back starting in August. So that will be really good to start seeing families again. We have 2 breastfeeding peer counselors with our program. One is a CLC, and then the other person is going through that right now. So that'll be exciting. We'll have both our peer counselors as CLCs, but otherwise not a whole lot new going on.
Thank you. And then we have Lynn T.
Can I ask a question first? For
yeah.
Lindsay and Jessica McCurdy, actually, about the CLC training. Are those both through Healthy Children? And they're online, and are they just 1 week, or is it spread out? What are the formats of the CLC courses that you're taking or that your staff member?
So the one I'm taking is going to be 52 hours online over 4 weeks. And Gemma could actually, Gemma's still here, you might fill in. I'm not exactly sure if the 4 weeks was determined by PHN or if that was from
it was determined by PHN. So it is through the Healthy Children Project. And we had really wanted to host CLC just kind of for the state. CLC's training for everybody in our community. And then COVID hit like literally that week. So, and we've been kind of like stringing along to see if they were going to do it in person, and right now they're still not doing it, which is completely understandable. So some of the nurses just very understandably wanted to get on that, so we decided to offer the online. And I believe, don't quote me, I think they offer it for 6 months at a time. Like, for instance, you have to complete the training within 6 months, but we're doing it because we have cohorts of nurses doing it. We're giving them a different time limit.
Yeah, so Olen is doing it, and as Gemma was just saying, she had 6 months to complete it. So she's just been working on it slowly and working through the modules and taking her exam really soon. So
awesome.
Exciting.
Yeah, that's really good to know what the options are right now. Thank you.
Yeah, it's so funny how much COVID has changed things, because when I took it, it was, a full week you had to take off from work. And if you were 15 minutes late to anything, you were like disqualified.
I know.
It was so stressful. I took it in Skowhegan, and I had to like stay with a friend up there, and yeah.
And having taken it, I mean, Jess can tell you, I took it about 2.5 years ago, and it was amazing. But I can't imagine doing it online, because the 40 hours of, right, Kelly, I see you nodding, just because it's so intense and it's so collaborative. But you know what? We're all adjusting to so many different things that, I think it's the opportunity to do it is better than to just wait.
Yeah. I've been waiting 2 years, and I just decided, like, I've had enough of COVID. I need something breastfeeding related. Sign me up. I don't care where.
Yeah, well, great. Well, good luck to all of you. I'm sure you'll do amazing.
I'll let you know next month how it went.
Great. So Lynn, did you have anything to share? You want to introduce yourself?
Yes, hi, I'm Lynn Taus, and I'm one of the nurses and lactation consultants at Penn Bay. And so there's 2 positive things that have happened here. One is that because Maine Health is allowing doulas in with labor patients, so Penn Bay is also doing that now. So that's what a relief to have that, and the whole baby steps. The mothers we still get a lot of people want their husband and their mother with them, and so we're hoping that Maine Health relaxes a little bit, so that maybe we can relax a little bit here on that as well. The other thing is Penn Bay just made an official room for employees that are pumping. So up until now, we've had to like just scramble around and find different rooms, and now and I just went today to check it and make sure everything was clean and all set up. And they had put this little sign that said lactation suite on the door. But that was so cute, because there's like a curtain and 2 chairs. So that's lovely. Challenges. So we have the pasteurized human donor milk that we available for our families here. And it's been about a year, and we're going to reevaluate. It feels like our policy is that if we offer this to moms, then part of the deal is they pump, that they really have to work towards providing their own milk. And we're finding that's not always the case. So we're having a meeting soon and try and reevaluate that. And I am curious if anybody is there who's a nurse at Maine Med, or if that's a common thing, or if that's just something that we have discovered here. And the other thing is Zoom support groups. So we've adapted to the Zoom childbirth education and breastfeeding classes, and we have moms and families interested in that. We really, the Zoom support groups though have not been a great success. And so I always, if I have somebody who really wants a support group and it's not happening here, it's nice to have Portland as something that they can connect with if they need to. But I just can't wait to get that back in person. That's what I hope, sooner than later. So, but that's it.
I hear that, Lynn. And I'm so glad. Yeah, please send people down. Where our numbers, as someone else had mentioned, or I think Ellen had said, like, we're looking for more people. So definitely, you know, it's hard to get people to keep coming back when there's only 1 or 2 other people joining. And so we're really trying to get the word out there as much as possible that at least, you know, even if they can't weigh their baby in this virtual group, or if they, you know, can't see people in person, it's still nice to not feel alone. Even in the 2 people that were in the group earlier this week for Maine Med, it was really special because the one person who had a younger baby, she was just so glad to have someone else to talk to. And then the person who had the older baby it felt so great to share her wisdom and her experience, even though her baby was only, I guess her baby was maybe 10 or 11 weeks. But she was finally able to be the person to share as the veteran mom, you know, with a 2 or 3 month old. So even if it's a small group, it can be really nice, but it's so much more powerful when there are more people.
Yeah.
So yeah, thanks for sending people down. And I also look forward to the time when we can maybe have both options, people in person or not. And about the donor milk and the policy in the hospital, I don't see anyone else here who might be able to speak to that, but please speak up if you have experience with this. But I've wondered too, I'm not as closely connected to Maine Med's policy and how they may have revised it in the past, but I've wondered how you define if a mom is pumping enough in order to receive that or qualify that donor milk. And I don't know.
So it's not on volumes. We don't, you know, it's not that, but we just were like, please pump. We don't care how much, it doesn't matter how much you get, but you need to be like showing us that this is your goal. This is what you want to work towards.
Right.
It's hard. Yeah.
And Lynn, are you on the listserv? There's a donor milk list, what is it, level 1, level 2 hospital listserv, hospitals that use donor milk?
Oh, yes.
That's a great place to ask.
Yes. That's a great idea.
I'm
Lynn,
so
I was
here and asked it too. Thank you.
Yeah, thank you. I was born at Penn Bay, so a special place in my heart for it. All right, so Petra, do you want to go next?
Hi, I'm Petra Neiland Campbell. You can call me Trix or Trixie. My pronouns are they, them. I'm on the MSBC board and I'm a La Leche League leader. I am on the La Leche League USA Council and I am the chair of USA's EDI committee. A couple of challenges that we've had in La Leche League. There's been a lot of EDI challenges lately. But one of the big things that we've been talking about on council is, you know, when are we going to feel safe offering in-person support again? Because La Leche League is really based around in-person support and kind of that community building. And while a lot of leaders are fine doing Zoom meetings and doing virtual support, there are leaders who are very much ready to get back to in-person support. So it's really, we've been looking at a lot of different factors and trying to take everyone's questions and concerns into consideration. And it's just, it's a tough spot to be in. Right now, council is still recommending to do virtual support because we just don't feel safe saying, yeah, you can, it's safe. You can totally go and do group meetings again. So those are just a couple of the challenges that we're working through as an organization. I am excited because of all the EDI challenges we have, we're really pushing for our leaders to do continuing education in EDI topics. So USA has hired Nikisha Killings. She's a Black IBCLC and she also owns an equity consulting business. She is creating a webinar specifically for USA leaders about racial and LGBTQ and just general EDI implicit bias type stuff. So I'm looking forward to that and hopefully helping our leaders to reach more people with their support. One of the other things I'm excited about is, I'll put a link in the chat, myself and several other LGBTQ leaders have created a Facebook group specifically for LGBTQ nursing families. We don't allow allies into the group, so it's a safe space for LGBTQ families who are nursing babies or who have nursed babies. We don't even allow leaders who are allies in. It's completely LGBTQ. So that kind of, I like leading meetings in there, and it feels a lot different than some of the other meetings that we lead. So yeah, that's kind of where we are right now. And I'm also looking forward to the USBC conference next week. We got the agenda yesterday, and I'm not quite sure how I'm going to pick which topics to go to, because there's a lot of good ones.
Yeah, that's always the hard thing, the overlapping topics. Well, thank you for sharing. And we have Rihanna next.
Hi, my name is Rihanna Pollard. I'm the breastfeeding coordinator and also a dietitian for the Bangor WIC at Bangor Health and Community Services, or Bangor Public Health and Community Services. We cover Penobscot and Piscataquis counties. And kind of similar to other WIC agencies, we're mostly on the phone right now. We do have the capability to do in-person appointments. So we do have those once in a while, especially for, electric breast pumps, or if someone would like to come in for a weight check. And then breastfeeding wise, we are still doing the newborn nutrition session. We're not doing that monthly anymore. We're doing that every other month. The newborn nutrition session that we have is led by our breastfeeding peer counselor, Mitchell Coles. So she holds a Zoom group where people can come to learn more about, basically infant feeding, and she focuses on breastfeeding. So she discusses like how breastfeeding looks in different families. She goes over like bottle pace feeding, and she covers a lot of topics. Same with Lynn. We haven't had much of success with those Zoom classes. We've had between 1 and 3 participants at each Zoom session. I mean, our max is 10, so it's really, not that bad, but we're definitely doing our best to promote that. And it's great content. So I'm glad that we have that option. Our peer counselor is also doing mini series videos. So those are 5-minute videos on a breastfeeding topic. So that's just, a quick way to get out breastfeeding education on social media. And then one of the challenges that I brought up at our last meeting was about promoting breastfeeding in pediatric and OB offices, just because we noticed in our community, there's been a lot of formula reps that have, kind of taken over those offices. So I brought it to our local coalition group, and we're kind of in the stages of planning how we want to go about, contacting these offices or creating materials. And I got so much information from so many of you at this meeting, and I brought it all to them, and we're able to do some brainstorming about that. So I definitely appreciate that. Another thing I just wanted to mention that we have been discussing in our local coalition, a breastfeeding coalition group in Bangor. So a while back, it was before I was here, but the coalition had created these little cards, and I have them on my desk here. And it's basically just a little card that talks about Maine's laws that protect breastfeeding. So it states what moms, or the laws that moms have for breastfeeding anywhere in public. And then the backside talks about the laws that protect breastfeeding women at their place of employment. So I do get quite a lot of people who see these on my desk and can I take a bunch of those? And so since I noticed that our coalition, we're working on, renewing them, or not revising, but just making more up-to-date ones. And then also we want to start kind of posting this in more local places in our community too, just because it still feels like, not everybody knows about this, or, just bringing it to our community can kind of help just bring awareness to that. So that's kind of some things that we're working on here. And then also I am going to be starting to help with the MSBC social media pages. So if you have any ideas, definitely send them my way. I'll drop my email into the box. It'll be my personal email, but yeah, so I'm really excited about that. Yeah, that's all my updates.
That's great. Thank you. If there's any way we can help you with trying to get, more breastfeeding information into the pediatric OB offices, let us know. And I think one way, the cards that you have, those are great. I definitely want to see those, but I think doing things around, like, is this true or false, or talking about myths, and then kind of saying those things can really intrigue people to learn about it too, if you're going to do that in like a social media way. But yeah, thank you so much. And then we have Valerie.
Oh, sorry to pause again. Amanda, do you see?
Yeah.
So Kelly has a great question, and Rihanna, I don't know if you saw the Valerie asked and Jessica asked about sending the cards to them, but Kelly asked a great question about other coalitions, and I think you were talking about the Bangor Breastfeeding Coalition.
Yes, so we collaborate. So it's with some doctors' offices, and we have mixed participation, but we have it with doctors' offices in Piscataquis and Penobscot counties. Some of the nurses there, or CLCs there, will attend. So it's a collaboration with nurses, public health nurses, Maine families, all of the people around that are, CLCs, or, just interested in. So it's in our area of like Penobscot, Piscataquis. So it's called the Bangor Breastfeeding Coalition. But I did see the comment, and I'm not sure about other parts of the state, but that would be a really cool collaboration if there is. And if anyone has information on that, that would be, if you could send it to me, that would be great, because I actually haven't heard of other places in the state with that.
Yeah, I feel like Aroostook at one point had a coalition. But this would, a lot of states, something I've learned at the USBC conferences and part of their communication is that many state coalitions are essentially, they have a representative from all of their local coalitions. So some state coalitions have representatives from, 50 local coalitions around the state, depending on the state. Whereas I feel like, we have our main state coalition and then maybe two other local coalitions. So I love the idea of you being here, Rihanna, to share what is happening within that coalition. And that is one of the ideas of having a statewide coalition. Does anyone know of any other ones in the state?
What was that, Kara?
I said, okay, continue.
Okay. Thanks for keeping tabs in the chat. Valerie, you can go ahead.
My name is Valerie Eldridge. I'm a breastfeeding peer counselor for Hancock County. I work with Ambrosia and baby Charlie. My biggest challenge right now is that we lost our breastfeeding coordinator. She got a wonderful new position that was made for her, and she's moved on. We're very excited for her, but sad for me. So we're kind of navigating the waters of like trying to do that too. I really need some bras here, and I don't know where to get them. if anybody could help me out with that, that would be great. Another big challenge of mine is that we're also doing a parent group too on Mondays. We've had no participants, and I guess my biggest challenge is not the fact that we don't have participants, it's the fact that I don't like doing it. I'm trying to find that within myself as how to motivate myself a little bit more to get excited about a project that I am not normally comfortable with. And other than that, things have been going pretty well as far as our moms and our babies. We got a bunch of supplies before Savannah had left. Besides bras, I need those. So we're doing well distributing those out to our families. We've had really good feedback about that. About a month or so ago, WIC was donated a bunch of diapers. So we have a little surplus of diapers we've been giving out to families, which is nice. We are seeing most of our clients still on the phone. We have had some come into the office. It's nice. If they need supplies, I can meet them outside so I can put a face with their names while I talk to them on the phone or text them. But yeah, other than that, things are going pretty well over here in Ellsworth.
That's great. Okay, Valerie needs bras. Anybody, if you got them? I'm assuming the nursing bras. So Valerie, if you're comfortable putting your email in the chat, you could do that. And if anyone has any ideas, or if anybody wants to chat Valerie privately, you can do that also. So I think that's everybody. Did I miss anybody? So any other comments or ideas that people had while we were talking about everything else?
All right. Excellent. Thank you all for sharing. This has been really great to hear what's going on and to have, I've loaded up that Google document with lots of different resources and events. So know that, again, you have access to that after and can continue to add things. And Valerie, I see that you jumped out and then sat back down again, but I'm going to send you an email to ask you a little more about your group, your feelings around a group, and we can talk about that more here if you want, but I'm happy to talk with you about that and hear where your challenges are with that, and more specifically, if you're open to talking more about it.
I'm back now. The mail delivery man came in. So yeah, I think honestly, I'm not shy of saying it. I have diagnosed ADHD. Zoom is not a strength of mine. I try really hard for it. It's just one of those things where it's hard, Yeah. So maybe it'd be good, I know of things that I need to work on with it, but maybe it'd be good to get a little pointers here and there. Because we've been doing it for 2 months, maybe roughly, give or take, and we haven't had any participants yet. So really it's just me sitting there for an hour making faces of myself, I
hear that. Yeah, it can be hard. And like I said, it's hard when even if you just have one person, sometimes it can still, for me anyway, it can still be a 2-hour group. If it's one person, it's just a conversation that continues on, which is great to be able to support that person. But yeah, the virtual format can be hard for sure. Yeah, I'll reach out to you too and see if there's anything else I can help with.
Awesome, thank you.
And so I'm forgetting your name, the iPhone person who you want to be added to, what is it you want to be added to? Just want to make sure we're catching that. Your colleague, Valerie, who is listed as iPhone. I'm not sure if she's hearing me. Oh, Ambrosia, thank you. What is it that you'd like to be added to? Maybe I'm just missing. Oh, okay, excellent. I will CC you, though I don't have your email address, Ambrosia, but maybe Valerie could add you. All right, so we're nearing the end of our meeting. Thank you all for sharing so much. I'm going to share the screen just to look through what we have coming up. And World Breastfeeding Week is coming up pretty quickly, August 1st through the 7th. And there are a few of us on the board who will be making some plans for the coalition, what we want to do for that week. We'll be meeting next week. If you want to join us, let us know. And all of August is National Breastfeeding Month. That's the USBC has declared that. And they have a theme for each month, for each week of the month. And so we will be doing lots of social media posts for those weeks. Thank you again, Rihanna, for your help with all of that. I'm so glad you mentioned that. I was going to recognize you and thank you publicly in this group for your help with social media. And then our next meeting is August 5th during World Breastfeeding Week. We don't have a specific topic or speaker yet, but we will. And we hope to do some different fun fundraising events as well. So stay tuned. Is anyone here doing anything for World Breastfeeding Week that you want to share or that we can help promote for you? Feel free to email us at mainebreastfeeds@gmail.com if anything if there's anything you want us to share. So I think we wrap up with sharing one thing that you are taking away from today's meeting. So I will start and say that I'm really excited about that Google Doc that just has so many things, so many resources and different events that have been shared. And I love the great representation that we have today from home of public health nursing to Maine Families, WIC, and the hospital setting too, in outpatient pediatrics. It's just really great to have so many people here. Anna Leachely looking through. So I am always just so filled up when I see everyone joining us today. So maybe we'll do another quick rundown and just share one thing that you're taking away from today's meeting. So Amanda, you would be next.
I think it's really exciting to hear that people are getting back into homes. Yeah, I think that's just the most exciting thing for me. I hope that partners can, be going into visits, prenatal visits again soon also, or maybe they are starting to, I'm not sure. But yeah, just hearing, things kind of opening back up in that way is really exciting. So thank you all for sharing your updates.
Awesome. Dr. Koppelman.
It is just so cool to get to listen to everybody and see what an amazing group of women is collaborating around all of this. Super cool.
Awesome. So glad you're here. Thank you. Amy Van Heeren.
Ditto to all of that, but I'm really excited about the milk depot, the donor milk depot. It's really exciting. I'm going to try and come.
Yeah. Thanks, Amy. And Brooke, I see, and she may have dropped off. Oh, no, you're right there. You're in a crowded, noisy room right now. Thanks for joining while multitasking and being 33 weeks pregnant. You probably, unless you want to stand up and show us your baby belly, I'm just going to pretend that it's just. So thanks for being here, and you're thrilled to learn about so many postpartum resources. Awesome. And I think Ellen is up next. And you're on mute.
Sorry, you'd think I of all people would tune into that, teaching for over a year online. Everything everybody has said, and I'm just so overwhelmed and overjoyed for all the support for, pregnant women, their partners, non-birthing, everybody and families. I love it. The commitment that's here, the commitment and caring.
Awesome. I agree. Ambrosia, I don't know if you're able to unmute and share what one thing you're taking away from the meeting today. And if not, feel free to type in your takeaway as well into the chat box. We'll move on to Gemma.
I'm just excited to see those of you who I haven't seen very much over the past year, and to meet the rest of you, and to kind of feels to me like the beginning of a collaboration that we've been really looking forward to. So thank you all.
Thank you for being here. Jen?
I'm taking away the information about the plan of care and how it seems as though there's going to be a great document too, or a great collaborative with different resources available to birthing parents, or recently have given birth people, and or pregnant persons.
Excellent. Thank you. So glad to see you here. And Jessica McCurdy had said, thrilled to see all your faces and learn the great connections to be made around breastfeeding. I have to pop off. Thank you for bringing PHN into the loop. Excellent. All right, and Catherine? Oh, you're on mute.
Thank you. I appreciate this beautiful collaboration of people, and all doing different things, and caring about similar things. And my resource list just got about 10 things longer, and that's really exciting. And I'm going to try to sign up for that workshop next week, and that's really exciting. Move around my schedule.
Awesome.
Thank you.
Glad you're here. Kelly?
I think diversity is what struck me today, is that we have geographic diversity, we have diversity of professions, and I think that's what's going to make this the strongest coalition. And I love that people are getting more and more comfortable and identifying things that they need. I would never in a million years would have thought about people needing bras. So I don't have a solution for you, but I think it's great that you bring that forward, and we can be thinking about that, and thinking about potential resources.
Excellent. Thanks. Thanks for making time to be here too, Kelly. Lindsay Matsopoulos.
Hi. One thing I'm really excited to hear about is Maine Care possibly covering donor breast milk. I have a client that I've been working with that's been asking me about that. So I'm really excited. Hope that all goes through.
Thanks. Good to see you. Petra Kaur?
I am excited to hear that in-person support for birthing and postpartum parents is kind of opening back up again. That's good to see. And I'm excited to hear that doulas are being allowed back into the birth room, because that is so important. And I'm going to be doing a lot more research into the plan of safe care, because that was something I had not heard about, not being actually in like a lactation profession, because I could see that being both a good thing and being a barrier of care to some people. So I'm going to be looking into that more, doing more research.
Awesome. Thank you. Brianna?
Yeah, so I really enjoy, I always say this at every meeting, but I really enjoy coming to these meetings, not only to learn more about, different topics that are being presented, but also the legislative piece of it. And then just overall networking with so many different professions and people around the state. It's really nice to have this kind of resource.
Excellent. Thank you. And Valerie?
First, I'm really excited about Petra Kaur's name. It's a Fish song, if you guys know the band Fish. I named my children after Fish songs because we met at a Fish concert. Anyway, but beyond that, I'm really excited about I think it was called the Breast Bus or something like that. And the cards that Bangor has, what I do a lot of the times doing breastfeeding peer counselor is talk about those laws with women who are going back to work and pumping, and how important those are for people to know. I know in our local agency or geographic area, we've had some challenges around employers providing safe spaces and quiet and clean spaces for breastfeeding moms to pump. The job before here, I was pumping in a closet. So it's nice to know those resources and to have that available for moms.
Awesome. Thanks. And Lynn Taus had said that she had to get back to work. She was nice. It was nice to meet such an enthusiastic bunch of people. It helps to keep me motivated. That is so great to hear. That's the hope. That's one of the hopes for these meetings, is that even though they're 2 hours long and it's the Zoom time, that can be really exhausting. I do hope that people leave feeling motivated and inspired to continue doing the excellent work that you're all doing. So thank you for doing that and for making time to be here. And we're at 3:01. So thanks. Have a great rest of your day and weekend, and until we see each other again. Bye.